Hi, my name is Barbara McPherson, and this presentation is about fluid compartments of the body and the ionic composition that's with them. So, the human body is made up of 80% water, which averages out to about 60% of water by body weight, which is somewhere around 40 liters, with the water being distributed throughout the entire body. Now, the amount of the water in the body will vary with certain factors such as age, sex, and mass or weight. For instance, the normal amount of water for an adult male is around 60% body weight, while the amount for the female is somewhere less than that at around 50% body weight. So gender and weight seem to determine the amount of water. Since there is less water in adipose tissue as there is muscle tissue, men have a tendency to have more total body water. Babies, on the other hand, have the higher amount of water, somewhere around 70%, because they have low body weight and low bone mass. Age will decrease the water in the body, the amount of water in the body. So the older you get, the less water you have in your body. Now, this image shows the distribution of water throughout the body, and it shows that the most part of the body that has water is the brain. That's 80 to 85%, with the least being teeth. Yes, I said teeth, and that's at 8 to 10%, with the remaining organs getting various amounts of it. The heart 70 to 80%, blood 50%, skin 70 to 75%. There are two major body fluid compartments. One is the intracellular and the other is the extracellular, and both of these contain fluid. So the intracellular fluid, which consists of fluid inside the cells, is the biggest compartment with water in it. It has 2/3 water, or 25 liters of total body water. The EFC, which consists of fluid outside the cells, contains 1/3, or 15 liters of the total body water. The EFC is further broken down into 3 minor compartments. So you can look on this image here, and it shows you that the fluid compartment's the extracellular here, and it shows you that it's broke down into plasma, interstitial, and transcellular. The transcellular consists of cerebral spinal fluid, pleural fluid, peritoneal fluid, synovial fluid, digestive fluids, and fluids of the eye, aqueous humor. Now, the plasma is the blood portion of blood fluid, the fluid portion of the blood, and is about 1/5 or 3 liters of the EFC. The interstitial fluid is about 4/5 or 12 liters of the EFC. The transcellular is a real small amount, somewhere around 3% of the total body water. In the compartments, there are electrolytes. So if you recall, electrolytes are charged particles that can conduct an electrical current in water. So the electrolytes, if they have a positive charge, they're cations. They have a negative charge, they're anions. And each compartment contains various types of cations. The major cations in the intracellular fluid are potassium, magnesium, and sodium, with the major anion being phosphorus. The major cations in the extracellular fluid is sodium, potassium, calcium, magnesium, with the major anion being chloride and phosphorus. So each of these compartments have the same ions in them, but they're going to be at different ratios, and that's on the next slide. Well, I'm sorry, not this one. First of all, I wanted to show you that besides just the ionic composition, there are some differences in it. The ECF has high concentrations of proteins, which are found in the plasma. And the intracellular fluid has oxygen, glucose, fatty acids, and amino acids. Each compartment contains both types of electrolytes, like I said a while ago, but they vary in different amounts. So the extracellular, where the main cation with sodium has 142 milliequivalents per liter, while intracellular only has 10. But if you look over here, intracellular has 140 milliequivalents per liter of potassium, while extracellular has 4. And the major cation for extracellular is chloride at 103. Now, even though these electrolytes have different composition numbers, the osmolality of them are consistent. They're both the same. And they have to be the same because when water moves across each compartment, the inside environment must be equal to the outside environment, or homeostasis will be thrown off. So, osmolality, and osmolality are often used interchangeably, but they are different. Both of them, however, are used to measure osmose in a solution. But osmolality deals with weight in water, and osmolarity deals with volume, and it doesn't have to be in water. The solution doesn't have to be water. So osmolality then is the measurement of the concentration of solutes in a fluid. So as the concentration of solutes go up, so does the osmolality. Osmolality is important in this presentation, in this discussion, because it's what causes the fluids in the compartment to move from one side to the other and back. So also there are forces involved in moving that regulate the movement of water. And these two forces are hydrostatic pressure and osmotic pressure. So you recall that hydrostatic pressure is the pressure that is exerted on the fluid within a membrane. An example of that would be blood pressure. Pressure is exerted on the capillary walls by the blood. Now, osmotic pressure is the pressure that prevents osmosis from occurring. So basically, these two forces are opposing one another. So in the image, if you'll look at where it says figure 1, you can see that the fluid, it will leave the capillary at the arterial end due to hydrostatic pressure. The force is pulling the fluid out of the capillary into the interstitial fluid. The fluid will then return to the capillary because of inward force on the osmotic pressure at the venule end of the capillary. That's number 2. So it's being pulled back in by the pressure of the proteins. The protein concentrations is what's causing the inward force. Once the fluid's inside the IF, the interstitial fluid, then hydrostatic pressure will push some of the fluid from the interstitial fluid into the lymph. And there it'll be circulated into the lymph capillaries, and there they'll be circulated in the body and then reabsorbed. Now, the movement of solutes is a little different. It's done by osmosis, active transport, and facilitated diffusion. Now, water will move by osmosis from an area of high concentration to an area of low concentration. No, from an area of low concentration to an area of high concentration. I'm sorry. So fluids in the compartments will move from the plasma membrane to the interstitial fluid back and then back, and then from the interstitial fluid to the ICF and then back. So water is constantly moving in each of these compartments. Now, the movement of the ions, sodium and potassium, they require a pump in order to move because they're too big and they can't go through the membrane. So the sodium-potassium pump will move sodium out of the cell and potassium into the cell. Now, this is a form of active transport because it requires energy in the form of ATP. Now, glucose and amino acids use what's called facilitated diffusion in the form of protein carriers to move the molecules across the membranes. This is passive transport and requires no energy. However, all three of these are moving against a concentration gradient. So with the movement of all of these molecules inside a cell, the term tonicity comes into play. Now, tonicity is defined as the concentration of one solution compared to that of another. So, in other words, you are comparing the solution type to the solute concentration inside the cell. So, in the fluid compartments, this would mean solutes moving from one compartment to the next. So, the image on the left shows a beaker of water with solutes that are moving by osmosis from an area of low concentration to an area of high concentration. So, if you look at the beaker here on the left, you'll see that on the left side of the semi-permeable membrane here, there's not very many solutes, but on the right side there is. So what's going to happen is water is going to move from the left to the right. And the second beaker shows you how the water has moved across that membrane, raising up the water level. Now the solutes are not moving, just the water. So now the image on the right shows tonicity levels in blood cells. So you have three tonicity levels. You have hypertonic, isotonic, and hypotonic. So say this that you have the solution is isotonic, then there will be no movement of water because the solute concentration is the same as the solution concentration. So there's no movement of water whatsoever. It doesn't need to balance itself out. But if you have a solution that is hypertonic and you place a red blood cell in a hypertonic solution, the water will move out of the red blood cell and into the environment, causing the cell to crenate or shrink. This is because there is a higher concentration of solutes in the environment than there is in the cell. Now, if you take a blood cell and you place it in a hypotonic solution, then water will move from the environment into the cell, causing the cell to swell up. This is because, again, there is more concentration of solutes in the cell, in this case, as opposed to the environment. And if these substances don't stay in balance, then you get disorders that occur because of the imbalance between these tonicities. And that's what we're going to talk about in a study that I located. So a study on electrolyte imbalances by Bala, Kosal, Coase, Armagon, Odzemeier, Inal, and Owner discuss how various mechanisms affect the equilibrium of electrolytes, and certain disorders can affect the electrolyte balance. Now, the study was conducted at an ER with 996 patients. All of the patients were over the age of 18 years of age, and some of them had different types of diseases, including malignancies, diabetes mellitus, hypertension, chronic renal failure, congestive heart failure, coronary artery disease, chronic obstructive pulmonary disease, and cerebral vascular disease. Now, all of the patients showed some form of electrolyte imbalance with symptoms including fever, systemic deterioration, edema, and tachycardia. Now, the figure here shows you the distribution of electrolyte imbalances. Sodium imbalance being the most common type, and the least common being magnesium. So if you look at the table here, it shows you that of the 996 patients, 600 of them had what was called hyponatremia, which is low sodium levels in the blood. And then 152 of them had what's called hypokalemia, which is low levels of potassium in the blood. And then 512 of them had hypocalcemia, which is low levels of calcium in the blood. And then magnesium is bringing up the least amount with 52. There are some hyper states in this. Hypernatremia is too much sodium, or too much potassium, or too much calcium, or too much magnesium. There's a few of those, but the majority of it, as you can see, is in a hypo state. Um, electrolyte imbalances can disrupt homeostasis, so they definitely need to be taken care of. Now, usually these imbalances manifest themselves either, like I said, in the hypo or hyper state. So the study found that electrolyte levels were lower than normal range in patients with chronic diseases. Now, that's going to be on this slide. So a majority of the imbalances are hypo in nature, with the highest imbalance in patients with malignancies. So if you look at this this table here, it'll show you that hyponatrium here, 230 patients with some type of malignancy also had the imbalance of hyponatrium. Also, 89 had potassium imbalances. Not very many in magnesium. Look at the number for calcium here. Hypocalcemia, 238 patients. And these are patients that all show some type of malignant, some type of cancer. Hypertension comes in next. There's not very much in coronary artery disease, but hypertension shows a lot. 190 patients had hyponatrium. Let's see, 140 patients had a hypocalcemia. Then diabetes mellitus comes in third with 144 patients with hyponatrium. And let's see, then 98 with hypocalcemia. And the rest of them are pretty minute. They're not big, but all of them showed some form of electrolyte imbalance. But the highest was by far sodium and calcium in malignancies. So, so patients that have electrolyte imbalances need medical attention. It needs to be fixed relatively quickly, because if it's not fixed, then it will throw the body out of homeostasis, and then when the body's thrown out of homeostasis, a patient could die. So that's what this study talked about, and showed that those findings. So thank you for watching my presentation, and have a good day.